Talk to everybody about lower cross syndrome. I
Mm-hmm.
know it was a discussion we
Mm-hmm.
were having before we jumped on call.
Mm-hmm.
I'd love you to kind of
Mm-hmm.
elaborate to everybody what that is
Mm-hmm.
exactly.
Yeah, so when you have like the really tight like quads and and then because when you can get it probably when you're doing a lot of sitting, right?
Hmm.
Because it kind of like weakens like the back muscles because we don't tend to have the best posture,
Yeah,
right?
no, we don't.
So yeah, it's kind of like how you have things um pulling in the front, and
Hmm.
then it's like more weaker, in the back
Yeah,
with all of those.
yeah, yeah.
Yeah.
Well,
Hmm.
it actually makes
Hmm.
like a crisscross,
Hmm.
right?
Yeah.
So you
Hmm.
get muscles that are
Hmm.
weak and
Yeah.
weak, like kitty corner
Hmm.
from each other.
Yeah.
So
Hmm.
short story, long story short, you
Hmm.
basically see a lot of times of people,
Hmm.
the abdominals are weak
Hmm.
and the glutes are weak. So that's the
Hmm.
crisscross there.
Yep.
And then you get really tight low back muscles, the
Hmm.
lumbar erectors, and really
Hmm.
tight hip flexors.
Yep.
And so that's just
Hmm.
why taking a
Hmm.
holistic approach with these hips and not
Hmm.
just, a quick 2 minute adjustment and out the
Hmm.
door, but actually saying, hey, if somebody really needs a deep dive into the musculature, I
Hmm.
refer them over to you to get that musculature work done.
Hmm.
Um, but again, like I just alluded to a second
Hmm.
ago, like it's not about just adjusting the hip by itself. Like
Hmm.
we'd be fools to not take advantage
Hmm.
of also addressing the lumbar spine and the
Hmm.
SI joint
Yep.
and giving exercises that improve the functionality there too.
Hmm.
So